All the patients in this room, all the feet that you see, they all have COVID.
As of April 30th, more Americans have died from COVID-19 than were killed during the Vietnam War.
Now the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April. We're in great shape though.
The virus, they're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
We have done an incredible job. We're going to continue. It's going to disappear. One day, it's like a miracle. It will disappear.
In the name of Jesus, we thank you, oh God, for this group holding up the arm. Yes, Lord. Yes.
Now the Democrats are politicizing the coronavirus. Coronavirus. It's all turning. They lost. It's all turning. Think of it. And this is their new hoax. 35,000 people on average die each year from the flu. Did anyone know that? 35,000. That's a lot of people. And so far, we have lost nobody to coronavirus in the United States. Nobody. And it doesn't mean we won't. And we are totally prepared.
Over 3 months since its first case was detected on January 23rd, the number of recorded infections had inched up to only 270, and so far no one has died. The population of Vietnam is 95 million, more than South Korea, Taiwan, and Singapore combined. The ruling Communist Party of Vietnam has declared, "Fighting the epidemic is like fighting against the enemy." It's so easy for people in Vietnam to understand the message because Vietnamese people have fought against China for 1,000 years, France for 100 years, and the US for 20 years. Vietnam was the first country to successfully contain SARS, which hit China, Hong Kong, and Southeast Asia hard in 2003. Hanoi learned from SARS that it had to react quickly to any disease outbreaks and take tough initial measures. Let's see the ratio of deaths to confirmed cases in the last column. That ratio in Vietnam is much higher than many other countries. Vietnam is one-party state, so naturally there would be doubt and question about its reporting. But let's see how they deal with COVID-19 with very limited budgets.
Coronavirus has since spread to more than 60 other countries who've handled it with varying degrees of success. Vietnam, for instance, moved quickly and, among other things, produced this incredible public information video about how to limit its spread through proper hygiene. Yes! Vietnam made a song about washing your hands to prevent coronavirus infection, and it absolutely slaps. That's a genuine club banger right there. In fact, people liked that song so much, it even became a TikTok dance challenge.
On January 11, with the first death in Wuhan, Vietnam tightened its border and airport controls. On January 15, when there were only 27 deaths in China Hubei province, Vietnamese officials met with the World Health Organization and counterparts from the Centers of Disease Control. On January 16, the Health Ministry alerted Vietnamese government officials on how to stem an unexpected virus outbreak. On January 21st, the ministry told hundreds of Vietnam's hospitals and clinics to start preparing for cases. The first cases in Vietnam were detected in an airplane passenger coming from Wuhan in January 23rd. 21 of their contacts were chased and isolated. By January 31st, the government had formed a National Steering Committee for COVID-19 Prevention and Control, headed by Deputy Prime Minister Vũ Đức Đam.
Bây giờ thưa các đồng chí, để chúng ta có thể nói là chúng ta đã thắng trong chiến dịch Mã Mã. Trong giai đoạn đầu của chiến dịch, chúng ta chưa chiến thắng cả cuộc chiến, nhưng mà nhất định chúng ta phải chiến thắng. Khó khăn thế, nhưng mà chúng ta đã lường trước mọi thứ. Chúng ta đã có kịch bản và sẵn sàng ứng phó, ngay kể cả khi có hàng ngàn người bị nhiễm. Cho nên là tới đây, một vài ngày tới đây, nếu có một vài chục, thậm chí hàng trăm ca nhiễm, thì cũng hoàn toàn không có gì bất ngờ.
By March 16th, Vietnam still had only 61 confirmed cases. Patient 61 was a Muslim returning home from a mass religious festival in Malaysia. The government immediately shuttered the mosque he has visited in Ho Chi Minh City and ordered the lockdown of his village for 28 days. At this point, anyone who has come into contact with a known case was pushed into immediate quarantine, and second contacts was ordered into self-isolation. Strict contact tracing, including secondary contacts, is the key to prevent the disease spreading to low cost in Vietnam. Regarding contact tracing, Vietnam, as a communist country, has large public security forces down to neighborhood and village level. The advantage that no democratic country has.
Of course, I'm disappointed a bit because I wanted to see all of these museums and sites, but I also feel like it's safer and like we have to be healthy, and if that's what's needed, then yeah, I agree with it.
For me personally, I would have loved to have seen it, but I think we should put the health of the Vietnamese people and of the tourists first.
The Health Ministry has also sent several SMS messages to millions of Vietnamese people to provide COVID-19 information, recommendation, and warning.
Hannah and I have been travelling together for the past 4 months around Australia and Southeast Asia, and my sister Lucy and another friend flew from London to Hanoi to come and join us for a little holiday.
Yay!
5 days in, the government turned up at our hostel and quarantined us all. We found out that there'd actually been a girl with corona on the same flight as them.
Vietnam Airlines from London to Hanoi.
So we had to wait in quarantine until medical tests were done. We waited 72 hours for our results.
And the verdict is in. Drum roll!
No, of course you're negative.
We get no corona. We get no corona.
Luckily they were negative, but we're still being kept in quarantine.
Now we're going to the military base. Great.
Oh my god, they're spraying the car.
Oh my god.
We are in an abandoned hospital. We don't have windows, we can't go outside, but we have a bed, it has a mosquito net on it. Toilet, we don't have a shower, but we do have warm water in a bucket.
I'd say the difficult part is the translation barrier, language. And they do serve us food in a bag, but it's quite good food.
Passengers arriving at international airports were quarantined for 14 days in camp run by the military, denially by all accounts. And on March 21st, all inbound international flights were cancelled, and most domestic flights and trains were cancelled soon thereafter. Anyone leaving Hanoi, where the most new cases were being detected, was quarantined when entering another province. The epicenter of the outbreak in Hanoi turned out to be the Bạch Mai Hospital. It is famous for being badly damaged during Richard Nixon's 1972 bombing campaign. It was traced to a man who had visited the hospital on March 12. His homecoming of 11,000 people was immediately closed off from the outside world. On March 29, the hospital itself, where the payload had now risen to 45, was locked down. By April 9, more than 1,000 healthcare workers at Bạch Mai and 14,400 visitors to the hospital has been tested. There's no question that Vietnam is an authoritarian state and its human rights record is poor, including severe restriction on freedom of expression and the control of information. Yet its handling of the pandemic has been strikingly transparent. It also had an enormous capacity for mass mobilization. Nonetheless, what Vietnam has accomplished in the first 3 months is to buy precious time, and it has used well. On April 23rd, some offices, shops, restaurants, hotels, tourist sites, sport venues, and other places in Hanoi, Ho Chi Minh City, and elsewhere reopened for the first time since scattered lockdown began on April 1st. The government relaxed the nationwide lockdown because no community transmission of Covid-19 in 14 days. For the people who are suddenly without income, businessmen and donors have set up machines that dispense free rice and provide $0 food in many cities across Vietnam.